Hello students, I'm Dr. Prachi, your pediatric educator, and today we will be discussing a very important topic about the NEET PG exams as well as the FMG exams, and the topic is fetal circulation. Yes. So students, you all know there is a difference between fetal circulation and adult circulation. So do you know the reason behind it? Why there is a difference between fetal circulation and adult circulation? Yes, the difference is because of the different units of gaseous exchange. In fetus, the unit of gaseous exchange is the placenta. And in adults, the unit of gaseous exchange is, yes, lungs. So because of this difference, there is difference in fetal circulation and adult circulation. Now coming to what are the differences, there are 5 important structures which we have to remember in order to learn the fetal circulation. Okay. So first structure is the umbilical vein. Second structure is umbilical artery. Third is ductus venosus. Fourth is ductus arteriosus. And fifth is foramen ovale. I'll be explaining it to you in detail now. So what exactly happens in fetal circulation? As I have told you that placenta is the unit for gaseous exchange in fetus. Okay. So through the placenta, this umbilical vein, it carries the oxygenated blood, which is rich in nutrients too, towards the liver. Okay. So now some amount of this blood mixes with the portal vein. Okay. And supplies the liver. But maximum amount of blood, it bypasses liver through the structure ductus venosus. This is the structure ductus venosus. And now this blood directly enters into inferior vena cava. So ductus venosus is a structure which joins the umbilical vein to the inferior vena cava. So now the blood that is rich in oxygen as well as in nutrient, it goes into inferior vena cava. And from inferior vena cava, this blood reaches into the right atrium. Okay. Now, 1/3 of this blood that reaches right atrium from the inferior vena cava, 1/3 of this blood enters directly from foramen ovale to left atrium. To left atrium to left ventricle. And now, from left ventricle, this blood goes into, this is the ascending aorta. Yes, the blood goes into ascending aorta. Yes, and it supplies the important structures of head and neck. That is the brain, most important structure. So this blood, which is rich in oxygen, goes into the brain. Okay, it supplies the head and neck. Now, the blood, as I told you, this is the 1/3 of the blood that directly crosses through the foramen ovale to the left atrium. Now the remaining 2/3 of the blood goes from right atrium to right ventricle. Also the blood that is coming from superior vena cava, yeah, this is the blood from superior vena cava, goes into the right ventricle. From right ventricle, this blood goes through, yeah, which structure is present in the right ventricle? Yes, right, pulmonary artery. So from right ventricle, this blood goes through pulmonary artery. But we all know that the lungs in a fetus are filled with, these are filled with water. So there is alveolar hypoxia is there. And this alveolar hypoxia leads to increased pulmonary vascular resistance in fetus. So because of the increase in the pulmonary vascular resistance, this blood that enters into the pulmonary artery, okay, the blood which enters into the pulmonary artery, it bypasses the pulmonary artery and goes into the descending aorta through the structure ductus arteriosus. Yes. So ductus arteriosus is the structure which joins the pulmonary artery with the descending aorta. So now this blood goes from ductus arteriosus to the descending aorta and it supplies the rest of the body. Now the main thing is the blood, this blood has less amount of oxygen saturation as compared to the blood that has reached our brain. So the brain receives the blood with maximum oxygen saturation and the rest of the body receives the blood with less oxygen, concentrated oxygen in the blood. Okay. Now, from the descending aorta, this blood goes into the umbilical artery and this deoxygenated blood again enters the placenta. This is the placenta. This deoxygenated blood again enters the placenta for oxygenation, right? So now I think you are all able to make out the various structures, the important structures that are present and the importance of these structures in maintaining the fetal circulation. Okay. So now again I am telling you once, the oxygenated blood through the placenta goes to the umbilical vein. Umbilical vein say by the help of the structure ductus venosus, it enters into, yes, inferior vena cava, which enters into right atrium, right. From the right atrium, this blood goes through the foramen. 1/3 of the blood through the foramen ovale goes into the ascending aorta, which supplies the brain and upper limbs. It have an oxygen saturation of 65%. And the blood, 2/3 of the blood from the inferior vena cava as well as superior vena cava, which enters into the right ventricle, it goes to the pulmonary artery, where it bypasses to descending aorta through the structure ductus arteriosus, and it carries an oxygen saturation of 55%. And then when it receives the blood, and then when the descending aorta through the, it supplies all of the body, and then the blood through the umbilical artery again goes to placenta for reoxygenation. I hope now you all are able to understand this thing. Yeah, right. Now the question comes is, then what happens after the birth? Why there is a change in this fetal circulation? Yes. So after birth, the unit of gaseous exchange changes. Now the unit of gaseous exchange is, yes, students? Yep, right, lungs. So after birth, when the child takes the first breath, the lungs expand and the lungs become the unit of gaseous exchange. There will be decrease in the alveolar hypoxia. Because of the decrease in alveolar hypoxia, there will be decrease in pulmonary vascular resistance. Because of this decrease in pulmonary vascular resistance, now there is, now the two circulations become different. Okay, so decrease in pulmonary vascular resistance, and now the blood from the right ventricle directly goes to, from the pulmonary artery goes to lungs for oxygenation and then enters into the left-sided circulation. Okay, so and what happened to the structures that were responsible for the fetal circulation? Slowly there are changes in these structures. These structures start obliterating because now there is no need of these structures. So these structures slowly, gradually, these obliterate. Now, number first is ductus venosus. Yeah, now you remember what exactly is ductus venosus? Ductus venosus is a structure which joins the umbilical vein to inferior vena cava. So this structure then obliterates. It closes by 7th day of life and it forms the ligamentum venosum. Okay. Now, structure ductus arteriosus. Now, children, you all remember what ductus arteriosus is? Yes, it's the structure which joins the pulmonary artery to the descending aorta. Okay. So there is obliteration of this structure too. The functional closure of this structure occurs immediately after birth, which is due to smooth muscle contraction. But the anatomical closure takes 10 to 21 days after birth. This occurs because of the intimal thickening of the ductus arteriosus. And after closure, this structure turns into ligamentum arteriosum. And if because of some reason this structure does not close, that is the ductus arteriosus does not close, then the child will have manifestations of PDA, that is patent ductus arteriosus. Is right. Okay. Foramen ovale, it closes immediately after birth. The umbilical vein and umbilical artery, they gets obliterated within first week of life, and umbilical vein gets converted into the ligamentum teres hepatis, that is the round ligament of liver, and the umbilical artery gets converted into the medial umbilical ligament. So the structures which were responsible for the fetal circulation, gradually these get obliterated so that now there will be proper functioning of the adult circulation. As I now just now I told you this patent ductus arteriosus. So what is the reason behind closure of ductus arteriosus is now this prostaglandin PGE2 is the natural prostaglandin which is required to keep this ductus arteriosus open in the fetal life. There are certain duct dependent lesions when we require this duct to be present even after birth. So to keep it open, we require an infusion of synthetic PGE1. So these are the questions which are frequently asked. Okay. But in the patients with patent ductus arteriosus, where we require the closure, the drug is indomethacin or ibuprofen, that is NSAIDs. Because of the cyclooxygenase inhibitor activity, these are the drugs given to the children. Thank you, students.